just make sure when you're ready to be, if you go into mute because you're not speaking, that you can either raise your hand via video or via the blue hand.
For the is raised.
Yes, and so for the general public, we will not do question and answer until after our 4 panelists have given their overviews.
So, Jasmine?
Yes, ma'am.
Are you going to mute me while Ms. Fair is talking, or you said I will not be able to mute myself at all?
You can mute yourself, but you can't unmute yourself. I can make you a co-host, and you can. So I've assigned you a co-host, so you can mute and unmute yourself. So you're all set. So whenever you're ready to start the show, then.
But you said I can mute myself, right?
Yes, you can mute and unmute yourself now. I gave you co-host abilities.
Okay, because I would like to be able to mute myself when necessary.
You can. You have that ability now. Yes, ma'am.
Okay, thank you.
Okay, no problem. You can mute and unmute. So whenever we have 4:05, so if we're all ready to go, we just wait. Is Hakim ready?
I'm ready.
Okay. Let me start recording. We are recording. Thank you, Mike. Council President.
I am ready. Good afternoon, everyone. And thank you for joining my community engagement video conference. Each day this week at 4 p.m., we would have different panelists on to talk about COVID-19 and the related issues involving COVID-19. This is an effort to keep the community informed and engaged while we are observing Governor Whitmer's stay home, stay safe executive order. Today, we're going to be focusing on quality of life issues. We first will hear from each of our panelists, and then we'll open it up for questions from the community. Our panelists today are Denise Fair, the Chief Public Health Officer for the City of Detroit, Hakim Berry, Chief Operating Officer for the City of Detroit, Erin Casey, Assistant Director for the Detroit Recreation Department, and Gary Brown, the Director for the Detroit Water and Sewage Department. I think we have our seatbelts on, and we are all ready to go. Will you begin for us, Ms. Fair?
Yes, thank you, Madam President. So my name is Denise Fair, and I am the health officer for the City of Detroit. We are experiencing something that we have never experienced before. And so at the health department, we have 4 main priorities. We provide community, we provide communication, we provide education, emergency preparedness, and also surveillance. And so you sent quite a few questions, and so I've tried to make sure that I'm able to capture those questions. So keeping Detroit residents is our #1 priority. And in an effort to protect residents, we continue to work with the Michigan Department of Health and Human Services, the Center for Disease Control and Prevention, as well as local health departments to actively monitor potential cases of COVID-19. So here's what we know. As of today at 12 noon, there are currently 2,086 confirmed COVID-19 cases, and also we have 73 deaths. That's just in Detroit. In Michigan, there are 7,615 confirmed COVID-19 cases, and the death toll is at 259. Someone previously sent in a question about the number of cases that are affecting all across the states. And we have now reported 140,904 confirmed cases and 2,405 confirmed COVID-19 related deaths. So as of right now, all 50 states, DC, Puerto Rico, Guam, the Northern Mariana Islands, and the US Virgin Islands have reported cases of COVID-19. This is real. This is our reality, and this is serious. And so I want to make sure that we provide you with information that you can share so that you can protect yourself as well as your families. So
I'm
what
just
is
stopping
COVID?
for 1 minute, Ms. Fair. Let me go back for a minute, because I know we have listeners that might be asking the question first. We're hearing a lot about coronavirus, but what actually is the coronavirus? So
Yes,
can you
thank
talk
you.
a little about that?
Sure, that leads me to my next point, which is what is COVID-19? So thank you for the question. So COVID-19 is a new respiratory virus. We first heard about it in December of last year, and the virus began circulating in humans. Health experts have been really concerned because little is known about this new virus, and it has the potential to cause severe illness and pneumonia. So that is COVID-19. Again, it's a virus. The symptoms of COVID-19, so how do you know if you have COVID-19? The symptoms may appear in as few as 2 days or as long as 14 days after exposure of the virus. And they include fever, cough, and shortness of breath. Those are the three primary symptoms. Again, fever, cough, and shortness of breath. How can you get it? We are still learning about this virus and how the virus spreads. What we've learned so far is that the virus is spread through the air by coughing and sneezing, through close personal contact, such as touching someone, shaking someone's hands, or touching an object or a surface that has the virus on it, and then touching your mouth, your nose, and your eyes. So that's how the virus is spread. But you can do quite a few things to protect yourself from COVID-19. First, and I know I tend to sound like a broken record when I say this, but it's so important, washing your hands on a regular basis with soap and water, or you can use an alcohol-based sanitizer. Avoid touching your eyes, your nose, your mouth, your ears with unwashed hands, Cover your mouth and your nose with a tissue or upper sleeve when you're coughing or sneezing. And so if you can see me just coughing right into your elbow. Avoiding contact with people who are sick. And if you yourself are sick, please do us all a favor and stay home. And also contact your health provider if you are sick. Also, if you are elderly or if you are already sick, limit your daily activities. Avoid large crowds and places where you are in close contact with people. So the city of Detroit, as I mentioned, we want to protect you and your loved ones. So here's what we're doing. First, we have a 24/7 phone line for the community. We launched this hotline a few weeks ago. That number is 313-876-4000. You can call that number in the day or the evening, and there's somebody there to answer whatever question or concern you may have. You can also send us an email at dhdOutbreak@detroitmi.gov, and we will answer your question within 24 hours. That's if you have questions or you need guidance. We also providing educational and social media posts similar to what we're doing right now. We have about 15 community health workers, and they have been going out into the community via telehealth and providing webinars to provide education to the community. And you can also go to our website, detroitmi.gov/coronavirus. There's a lot of tips on that website as well. And so again, I'm your health officer, and I want to make sure that we're providing you with the support that you need. I realize this is now our new reality. We don't talk enough about separating yourself from other people. I think you may have heard of social distancing. What that really means is staying at home. Do us all a favor. If you are sick, stay at home. If you, if you like to go out and about and go to parties and go to other functions, we encourage you not to do that because the virus can spread really quickly. So please stay at home. I mentioned on a press conference the other day, I have a Bible study at my home once a month. And it's the responsible thing to not have that Bible study, but to have it via Zoom or via some sort of conference call. That way I can still interact with people, but the virus is not easy to spread. So again, stay home, go to the grocery store maybe once a week if you can, limit those activities. Governor Whitmer now has this initiative, which is stay at home, stay safe in order to save lives. And I wholeheartedly believe that. So I'm going to pause here and I'm going to turn it now over back to Madam President. Thank you.
Let me ask you a question, Ms. Fair, if I can. As we're talking about the virus, can you just say when it seems that it first appeared in the United States, and when did it seem to first appear in the city of Detroit?
Sure, good question. So the virus really we started hearing a lot about it in December of last year. And then I remember almost the exact date. It was Super Bowl Sunday when I was getting ready to watch the game. And all of a sudden, all the health officers, we were on the phone with the state, with the White House, with CDC, trying to figure out how we're going to plan for the first flight that was coming from China directly to Detroit, Michigan airport. And so from then, it has just literally taken off. About 3 weeks ago, we had our first case. And since then, we went from 0 cases to over 2,000. And the virus continues to spread. Again, the best way to slow the spread is to please stay home and to practice those home and hand hygiene products or practices that I just mentioned.
Okay, and you've told us about the statistics that we're seeing happening around Detroit, around Michigan, around the United States and around the world. And it seems as though the statistics are showing Detroit have quite a few numbers. Let me just ask you a question. What are the affected age groups and the sexes? Is it affecting more women? Is it affecting more men? Can you talk about that?
Sure. So we're seeing that most of the cases are spread between the ages of 40 to about 59 years old. So that's kind of where the spread is. 40 to 69 years old. That's where most of the cases are. And we also see a 50-50 split between male and female.
Okay. I'm gonna go back to the medical side of it again, because I understand that Detroit is asking for medical professionals to assist. How can, if they want to assist, how can they volunteer or how can they get involved?
Sure. Thank you for that question. So if you want to volunteer, please send us an email, dhdOutbreak@detroitmi.gov. There are so many types of volunteers that we're looking for, from medical professionals to people just to do admin work, data entry, but send us an email. At this point, it literally is all hands on deck. And I've been really pleased with the volunteers that have that have really stood up so far and have been really supportive of the city of Detroit. So again, dhdOutbreak@detroitmi.gov.
So Detroit seems to be partnering with the state very well, partnering with other counties, with other municipalities. Can you talk about the partnering with the state and the partnering with the federal government?
Sure. So one of the great things that we have a great partnership with all of the local health departments, pretty much in the Southeast Michigan region. That includes Oakland, Wayne County, Macomb. In fact, all of them have partnered with the city of Detroit to develop this new drive-through testing, which is what Hakim will discuss in a few minutes. So that has been a great partnership. We always share best practices. We have a call every day around 2 o'clock just to learn from each other. We're also great partners with the state, with the Michigan Department of Health and Human Services. Dr. Jonay Caldoun has really been in our corner, providing a lot of guidance and support, especially to me as a new health officer. I really appreciate all the support that she has given to the city of Detroit.
Okay, and lastly, can you talk about the biggest challenges that you've seen and also the biggest successes that you've seen?
Yeah, so I think the biggest challenge that we have experienced is the fact that this is so new to all of us. We are literally in uncharted territories. And so we're learning so much. We get the information changes even by the hour. And so the Detroit Health Department, we are keeping up with our new reality with these new changes. So I think that has been the biggest challenge. And I think also making sure that we are communicating, you know, we usually will communicate through some sort of large gathering, but because we can't do that anymore, I think the challenge is making sure that we are communicating electronically via social media. The biggest success, again, I have really been impressed by the city of Detroit, who have really just been phenomenal in terms of their support for us. It's really interesting just seeing all the volunteers say, what can I do? What can I do to help and to support? I think another big, a really big success is the fact that the health department stood up a 24/7 call center within a matter of just a few days. So anytime someone has a question, they can call us directly, or they can also send us an email. So that has been a big success for us. And then again, just continuing to work with the state, with the CDC, working with City Council, working with the Department of Neighborhood so that we can continue to get that message out there to our residents.
Thank you so very much for all of that great information, Ms. Fair. Just one more time again, if people want to just check, they have questions, they're wondering, could I possibly be infected? Can you just give the number that they can contact again?
Sure. So we encourage people, if they have symptoms, to call their primary care provider. If they don't have a primary care provider or physician, they can just call the Detroit Health Department 24 hours a day, 7 days a week at 313-876-4000. Again, 313-876-4000. Or you can send us an email at dhdOutbreak@detroitmi.gov. Again, dhdOutbreak@detroitmi.gov.
Thank you so very much for all of that information. Thank you for all of the work that you're doing along with your team, and we look forward to continuing to work with you. Thank you again. I'm going to now move on to Hakim Berry, who is the Chief Operating Officer for the City of Detroit. And I see he has his mask on his face. He's making sure he's staying safe and precautious. So, Mr. Hakim Berry, can you just talk about what's going on with the testing sites?
Sure, I'm actually live at the testing site. So this is our day 4 that we've been open. We opened up Friday afternoon and Saturday all day, and Monday and Tuesday we've been here for 10 hours per day. What this is that we were able to transform the west end of the state fairground property into a drive-up test center, and that can accommodate up to 500 tests a day. The mayor was successful in partnering with JP Morgan and Jamie Dimon to find test capacity for the city of Detroit. And with that, we were able to get 500 tests that we can provide those who can come through there. We partnered with, we call it a tri-county deal because we partnered with Macomb, Oakland, and 3 of the health systems that are represented in those counties. So Detroit Medical Center, Henry Ford Health Systems, and Trinity Health System, specifically St. Joe's Hospital. And what they have done is volunteer their staff here to conduct the testing with the nasal swab of any of those that come through the drive-up center here. The process to get a test is to basically anyone in our tri-county area, including our Metro Detroiters and residents of Detroit, you go to your personal care physician and you get a prescription to have a test. And then once you have that prescription, you can schedule a test and we'll give you a block of time and come in here. You'll be here no longer than 15 minutes or so. I think you had some more questions that you wanted me to answer here. I'm trying to pull them up.
Thank you so much. And how is things going at the State Fairground with the volunteers? Approximately how many volunteers would you say you have at the State Fairground?
For healthcare workers, we have about 12 or 13 total from the different hospital systems. And with our city employees, there's about another 35 or so to manage the traffic and the additional services to make sure people are safe and can get through this testing, the testing site.
Okay, and what city departments are functioning out there?
Out here, it's a mixture of departments that have donated personnel. So we have Department of Neighborhoods, the General Services Division, um, uh, um, the mayor's office. We've had some council members come out and participated. People from the demolition department, and it's rotating. So as we're going on, we will see more from their various city departments. As we are like many others in the city, we have curtailed non-essential operations in accordance with the governor's orders. So we're providing alternative work solutions for those City of Detroit employees.
Okay, thank you so much. We hear that TCF is going to be converted. Can you talk about the conversion of TCF?
So that is a preparation for what they call in the healthcare system is a surge. And right now, as there are sick patients going to the hospitals, the bed capacity is becoming limited, and the acuity of the patients are becoming severe. So with that, they have to prepare to provide health care to those patients that cannot go into a hospital. So TCF is being prepared by the Army Corps engineers so that they can take the patients that are not severely ill or in critical condition, that they can care for them in a remote stand-up hospital, and that's what TCF will be transformed into.
Thank you. And when do you think the conversions of TCF will be ready?
I know they started, I believe it was today, but it may take them a couple days to construct it. They're the experts in standing those up, but so I imagine somewhere by the end of the week, they'll have it situated.
All right, thank you so very much. Let me talk about, I know something exciting is coming, and that is the rapid testing kits. Can you talk about the rapid testing kits and what's going on and what can we expect?
So the rapid testing kit, we were one of the first customers that were able to procure these from Abbott Laboratories. And the rapid testing kit can give a result within 5 to 13 minutes, depending on whether it's positive or negative. We've purchased enough to basically give quick responses for our first responders. We're in a situation now where we have a couple hundred police officers that are in quarantine and either waiting on a test or waiting on a result. And with that, we don't want to put our public at risk, but not having first responders ready. So with the rapid test, we can easily test a first responder, let them know instantly if they're positive and negative, and they can return to duty.
Okay, thank you. And when do you think can you talk about the procedure and how long it would take?
The procedure for the testing?
Yes.
It takes 5 minutes for a positive and 13 minutes for a negative result. It's a point of care machine. It's many people who have ever had a health check and provided maybe a prick on the finger and their glucose check. It's the size of that machine, but they're still using swabs. We should have those in by the end of the week and have our staff trained up somewhere around then as well.
Okay, I'm having a lot of people talk about the mask, and I know Ms. Fair talked about the mask. You have your mask on. Can you talk about the mask and the gloves and the wipes that the city has purchased, and whether or not the city has sufficient masks, gloves, and wipes as needed?
I will say there's never enough, and especially when we're in a drive-up testing site, there's certain healthcare safety protocols that will require you to change your gloves after every patient that you care for, and then your mask after it's soiled. So we have protocols based on that. We call it personal protective equipment, and it's on a national shortage. So we are constantly in a mood of procuring more and more to help those city workers that are not quarantined at home or under the governor's orders at home to stay protected. So you will see a lot of our city employees wearing masks, especially when they're working in the public. You'll see that with our police officers, our firefighters, our EMS, and our bus drivers as well. As Denise has always said, that hygiene is the most important thing, to continue to wash your hands, to use hand sanitizer when you can. The reason why you see me with a mask is because I'm in an environment where there are some people that are possibly infected with the virus. So in order to protect myself, all of our staff here on site are required to wear a mask and gloves and the like.
Thank you so much for that information. If someone wanted to donate supplies, how and where would they donate those supplies to?
We have I don't think we have a formalized phone number other than people calling me, and I make arrangements to have those picked up if they're donating personal protective equipment. I'll give out my office number, and if no one answers, they can leave a message. We are checking those daily, and that's 224-9514. And we are accepting donations to help our workers stay safe.
Okay, thank you. Let's talk about our first responders. And our first responders, our police officers, have been hit extremely hard. I want to give a shout out to Greektown Casino, who has made their facilities available for our first responders. But can you just tell us about how our first responders are doing, and if there's anything we can do to assist them, if there's anything else they need?
Well, first, our first responders, many of them have been quarantined because they might have been in primary contact, and they're waiting to come off quarantine. Some of them have contracted the virus. Fortunately, we did lose an officer and a 911 dispatch operator. And we hope that we can keep them safe so that it doesn't increase anymore. We are providing them the necessary personal protective equipment so that they can stay protected. And so if you have donations of personal protective equipment, we are making sure they are getting those. Greektown facility and several others have offered residential accommodations for them so that they can remain in a sterile environment and continue protecting the public. So we're very appreciative of that offering.
Okay, and at Greektown, I think they made rooms available, and they are making food available to the first responders as well. Is that also true?
Yes, they have given us, I believe it's 2 floors, and their hotel is closed. So they've actually stepped out there and was the first to raise their hand and open up the hotel for us to accommodate us, and we can stay there. And I opened up the garage so that our officers can park there as well. So yes, very true.
And again, I just want to give a big shout out to Greektown for the assistance that they have given us. I want to give a big shout out to all of the workers who are at the state fairgrounds assisting our Michiganders, because this is truly a time where we need each other, And I just want to say thank you to you, Mr. Berry, for all of the work that you have done, all of the work that you continue to do. And, you know, let the workers out at State Fairgrounds know that I truly appreciate everything they're doing. The city of Detroit appreciates everything they're doing, along with all of my colleagues who I know many of them have been out there volunteering. Again, thank you so much. I'm going to let you get back to the work that you're doing out there. And again, you're truly appreciated.
All right, thank you, Madam President. We're here to serve.
Thank you so very much. I am now going to move to another important topic, and that is the food and the meal services for our youth, the families, and the seniors. And so I'm going to ask Erin Casey if you would talk to us, and she's the Assistant Director of Recreation for the City of Detroit. If you can just talk to us about what's going on and how we are assisting those that are in need for food and meals, and how can they get that assistance?
Sure, absolutely. Good afternoon, Council President Jones, and good afternoon, residents who are joining us on the call today. So the City of Detroit Recreation Division, we've been hard at work ensuring that the youth in our community who typically rely on school breakfasts and lunches can continue to count on those during this crisis. We're also ensuring that our seniors continue to receive service, and families more broadly. So the schools closed in Detroit on the 13th, and our department quickly acted to begin providing meal service to families the following Wednesday on the 18th. So that first week, we opened up 3 rec centers to have drive-up meal service for families. And in that first week, we served just over 18,000 meals. To receive service at those sites, what families can do is they can pull the car up to the curb in our rec center parking lots that are offering these meals. They let our team know how many children they have at home, and they're able to pick up a breakfast and a lunch for every child that's in the home. If they need to pick up meals for 2 days, they're able to do that if they're unable to come back daily. On Fridays, they're able to pick up meals not only for all children in the home, not only for that Friday, but also enough meals for Saturday and Sunday. The following week, on the 23rd, we increased the number of meals that we were serving. And so last week we served a total just over 30,000 meals to youth across the city. And then this week we added 1 additional 5-day-a-week site, and then we added 2 additional sites that are serving 3 days a week. And this week we project to serve nearly 40,000 meals to youth across the city. We're also partnering with Gleaners. Gleaners is hosting mobile grocery distributions at our rec centers. Those are occurring bi-weekly, and so families can pull their car up into the rec center parking lots at the scheduled distribution times, and families can drive through, and Gleaners will provide them with enough groceries to last them approximately 2 weeks. So not only are we serving prepared meals for youth, grab and go things that are easy for kids to eat themselves during the day, but we're also making sure with our partners, Gleaners, that families can still cook together and enjoy a meal at home together. The Detroit Area Agency on Aging is continuing to provide congregate meals at 5 of our rec centers. So seniors who are pre-enrolled are able to come and pick up 5 frozen meals on Wednesdays at the sites that we're partnering with DAAA at. And if seniors are not enrolled, they're able to enroll on site. We are working with the Detroit Area Agency on Aging to continue building capacity so that we can serve more seniors. And we're continuing to work with them to also help get some of the seniors who are currently on their home delivery wait list off of that wait list. And just one note in terms of eligibility, when families drive up to receive meals at our sites, we don't ask for ID. We just ask the number of youth that are in the home. For folks who have transportation challenges or maybe are concerned about leaving their house because they have an underlying health condition themselves, we also allow for a neighbor or a member of their church or someone else to come and pick up meals for multiple families if that works better.
Thank you so very much. It is so important to ensure that our seniors, our kids, the families are fed. And, you know, I talked about how I knew at one point kids were only eating at school. And so I really had a big concern regarding our children, because I remember there was one school where we were literally told that the kids were not eating their food on Friday because they were scared that they would have nothing to eat on Saturday and Sunday at home. And so they were trying to pack their lunches and up that they received on Friday so that they would have food at home for the weekend. I thank you all at the Recreation Department. I thank all of the volunteers who are there to assist the families, the seniors, the children on making sure they have food. Thank you so very much for the work that you're doing along with your team. You are truly appreciated. We could not get through this without team help. So thank you so very much.
Thank you.
Our next discussion is going to be on water issues. And standing by is Director Gary Brown. Mr. Brown, and he is the director for DWSD. Can you talk to us about what has happened in the city of Detroit, what continues to happen in the city of Detroit? Give us any statistics that you have, any numbers that you have where people can call. You know, water issues is a big concern with people. It is a truly big concern, and we've been talking about water issues, but right now, especially right now, during COVID-19, where you're hearing everyone say, make sure you wash your hands, make sure you wash your hands. Talk to us about what's going on with DWSD, and before you do that, let me also give a special thanks to all of the men and women at DWSD as they come in each day and do the job that they are doing during this period of time.
Thank you so much for giving me the opportunity and saying that. You know, as you know, I've worked for the city for many decades. And I can't tell you how proud I am to be working with a group of professionals like the speakers you've had on today, our health department director, as well as our COO. They are dedicated, they're accomplished, they're competent, and they are out there getting it done. And I'm just I'm proud to be a colleague of theirs. And I've worked for a lot of administrations and worked with a lot of different executives, and they don't take a backseat to any of them. They are getting the job done. So I want to thank them. And then just as you did, I want to thank the men and women of DWSD, because they don't often get talked about as being, you know, the emergency police, fire, or EMS, but they are just as important to the mission of knocking this virus down as anybody else. And they have the same fears and concerns that anyone would have. They don't want to take this virus home with them and pass it on to any of their family members. And they certainly don't want to give it to any of the customers. So with those concerns, they come to work every single day and get the job done. So let me talk about, first of all, you've heard the other two speakers talk about the two things that are going to bend the curve are social isolation and washing your hands. and practicing good hygiene. You can't do that if you don't have water. And so the mayor and the governor came up with a plan. We've labeled it the Restart $25 plan, and it is designed to do one thing, and that is get on the water of any Detroiter who is currently living in a household without water. And it's a very simple plan. For as long as this emergency goes on, that customer, if they enter into the $25 Restart program, will only have to pay $25 a month for their water bill. And the state of Michigan will pick up the first $25. And we wanted to make this a very simple plan. We don't want them to have to stand in line, come to a customer service center. We want them to be able to just call one phone number at Wayne Metro, which is 313-386-9727. That's 386-9727. Call Wayne Metro. They'll ask a few questions and take a survey, get them an appointment for a later date, but most importantly, they will send that address over to DWSD and a work order will be created, and hopefully within 24 to 48 hours, we will get the water back on. Simple program.
Let me ask a question, Mr. Brown, because I know you're saying call Wayne Metro, but I also know that there were people that were going out to some of the homes and they were putting hangers on the door. How successful was that?
Extremely successful. So what we did is we looked in our database of our billing system, and we looked at every household that had been cut off from January 2019 to date. So a little bit over a year. Every household that had been cut off and was not back on in the system. And there were 9,000 of those addresses. And we sent people to go out and knock on the doors of those addresses. If you were home, fine. They handed you the literature and you simply dialed the number and we came out and got the water on. If you were not home, then a door knocker was placed on your doorknob that gives you the information to call Wayne Metro and get your water back on. And so more than 10,000 Detroiters called Wayne Metro, most of them based on the door knockers that were put on the doors, and approximately 1,000, exactly 1,073 were put into the program. The other people that were calling didn't qualify for the program. It takes just two things to qualify for this program. Your water has to be off and you have to be living in the home. And so today we received quite a few calls that said, we've just signed a lease. We're going to be moving into this piece of property on April 1st, and we'd like to get into the program. You don't qualify. If you signed a lease with a owner of a piece of property and it doesn't have a water meter and the water's not on, it's that landlord's responsibility to get the water on. This program is designed for people that are living in the house currently today and the water is off. Not for people that are in another assistance program like RAP. You can't switch out of RAP and get into the $25 program. You can't be in the 10-30-50 plan and switch into the $25 program. The $25 program, and this is important because we're getting so many calls from people that don't qualify, and they're saying that they live in the home, and then when we get there, there are no walls in that home. These are investors that are trying to get us to turn on the water for a piece of property that they're trying to fix up and rent. That doesn't qualify for this program. You have to live in the house and you have to be out of water. So we went to 9,000 homes. We notified those homeowners and they began calling. We now have 1,073 of those customers in the plan. Most of them are on. There are about 100 or so that they weren't home when we came out to do the fix. And so we're going back this week to see if we can get into those homes and make those fixes. And then we have some of the homes that have some very severe plumbing issues. I'll give you an example. The first thing we have to do to turn the water on, we turn it out in the lawn at the stop box. If the stop box is broken, we dig it up and we repair it. And then we turn the water on and put a meter in the house. Once we get the water into the house, we've turned it on and then it comes up through the floor. So the pipe up under the floor is broken. And so we have to get a master plumber to come out and go through the concrete floor, go through the wall of the house, put in a new service line, and that may take a day and a half or 2 days to complete that job. So some of the homes that we're dealing with have very severe plumbing issues, but the good news is that we have 4 Detroit-based plumbing contractors on site that are doing those repairs, but it's a little slow because of the complexity of the homes. And so we're hoping that right now I'm looking at the dashboard as I'm on my computer. There are only 49 of the 1,073 homes that we haven't been to yet. And our workers are out there right now. I'm confident by the close of business tomorrow, all 1,073 customers, we would have touched them all. We would have got 90% of the water on, and we're working on that last 10% that has severe water issues.
Again, how many customers did you say we have turned on through that program, that called, that said, I need assistance? How many did you say we have assisted?
We have about 1,000 customers in that program that we have assisted already. We've gotten their water back on. I want to also say since March 12th, when the program started, DWSD has also cut on 14,000 other households that were off in water, and they're not in the $25 plan. And so we're confident that we'll be caught up by the end of the week, and we'll be able to keep up with all any other calls that come in shortly.
I want to take the opportunity to thank the Plumbers Union who stepped up to the plate to assist fixing these pipes that needed to be fixed. It's amazing when you have situations like this, how people just step up to the plate to do whatever they can do to assist those that need to be assisted. So I want to especially give a shout out to the contractors, to the plumber unions who have stepped in to assist, and again, to all of DWSD workers who are out there assisting and making sure our Detroiters have water. Let me ask you, how many customers, again, do you say today does not have working water service?
Well, I don't know how many in the city of Detroit, because there are a lot of customers that don't have accounts. The households, we don't have insight, don't have meters, so we don't know exactly how many. But I know this is the opportunity to get the water on, and we're going to find out after this program ends just how many Detroiters were out there. I think the number is going to be somewhere between 1,000 and 1,200. That's what the data looks like that's coming in. But every Detroiter has an opportunity to not have their service disconnected if they simply ask for the help. The problem is getting people to come in and apply for the assistance.
Let me take this opportunity to say to Detroiters, if you know someone, if you do not have working, running water, take this opportunity. You can contact my office and leave an address, leave a phone number. That's 313-224-1245. Although my staff is not physically in the building, we are still working. We are checking voicemails. Please, please, please get in contact with us. Get in contact with Metro Wayne. Get in contact with someone to make sure you have working water service. I see a hand raised. We're gonna go into questions in a minute. And so if we can just I think it's Elliot Buckley who raised her hand. Elliot, you want to go ahead? Okay, in the meantime, while we're waiting for to get these questions answered, let me ask you one additional question, Mr. Brown. If a person is a squatter that's living in a home, are we working with those individuals trying to get that water on as well?
Absolutely, absolutely. And that's where, during this emergency, the governor has done an executive order. On several occasions today, we had landlords call and say that they don't want the water on, turned on. They don't want the water turned on. And we tell them, first of all, there's a moratorium. We can't cut any water off, even if you're the owner of the property and you ask us to because you want that person out. Right now, we're only turning water on. We're not turning water off. With people that don't have a legal right to be on the property for whatever reason, during this emergency, we're not asking a lot of questions. We're turning the water on to give them an opportunity to be able to wash their hands during this crisis. And we'll work with them after this is over to get them into the WRAP program and find these wraparound services, because the person that you just described, turning their water on doesn't necessarily change their life circumstance very much. They need heat, they need electricity, they need food, they need prescriptions, they need a lot of things. And the good thing about Wayne Metro is they have the dollars to provide the wraparound services where they can wrap their arms around these families and solve their problems holistically, as opposed to piecemealing, just turning on the water. That's not going to change the outcome for those kids and that family very much. They need other things, and we provide those services also. Gas, lights, food, prescriptions, a lot of different services.
Okay, I want to go to our callers. Again, I want to thank you. I want to thank my colleagues today. I want to thank you as well for passing the resolution that I introduced today to ensure that once this COVID-19 piece is over, and I don't know when that's going to be, but as people are paying their bills to the best of their abilities, that they are not charged the late fees and the penalties. I know you still have to take it to your board to get it approved by your board. I also ask that it goes to the Great Lakes Water Authority, because we know that this is not something that's just affecting the city of Detroit. Again, it's not just for residents, it is for businesses, it is for churches, it's for everybody. It's for all that has water services. We know that you're gonna have a hard time once we get through the hard part of this COVID-19. And so thank you so much for receiving that resolution. I look forward to you introducing it to the Great Lakes Water Authority, and I look forward to them passing.
Yeah, I'm proud to be able to take it. Tomorrow I'll take it to DWSD's board, and the following Wednesday I'll take it to Great Lakes Water Authority's board.
Thank you, and I look forward to it being passed to be able to help everyone that's in the state of Michigan that's part of DWSD as well as the Great Lakes Water Authority. We need hope, and that's the name of the game. Let's come together, help each other, and there's hope somewhere in all of this that's going on with COVID-19. Let's move on to our questions that we have. And I'm going to come back with you with something else after we get through some of these questions and concerns from our callers. And the first caller is?
Council President, before we start the Q&A, if you are on your phone and you would like to make a call in order to make a comment, in order to raise your hand, you need to press *9. And if you are on video, you will want to click raise hand, and our Chief of Staff, Stephen Grady, will go in the order and he will unmute you one by one. So again, if you are on a call, you want to press *9. And if you are on a video call zoomed in, you will want to press raise hand. Thank you.
Want to press what? Raise hand.
Raise hand.
*9.
Yes, *9.
Okay. I want to just let everyone know that if you are on the phone and you want to ask a question of some of our panelists, if you can press *9. If you can press *9 if you are on the phone. If you are on the video conferencing, if you press raise hand. And my Chief of Staff, Stephen Grady, will see that hand raised and we will be able to get your question and your comment. Let me also say, please refrain from any vulgar language. Let's use respect during this period of time. Thank you so very much, and thank you for your patience, and thank you to all the panelists.
Madam President?
Yes.
I have the first raised hand, and I'm going to raise your hand, Calvin, but I'm going to give this disclaimer to everyone. We have been vigorously blocking people who have been projecting pornographic images and trying to use other means to disrupt this video conference. So Calvin, I'm not saying that that's you. I'm going to unmute you so that you can speak. But if you have that type of activity going on, you will be removed from the video conference. Calvin, you're able to speak.
Calvin, you have 2 minutes.
Good afternoon, all. Mr. Brown, what is DWSD doing about working water? I know you just explained the situation with regards to running water. So people have running water, but it's not working. And how it's not working is that sewage backup and the like. So we have experienced a lot of sewage backup. Is there any plan or anything that any individuals could do to deal with running working water and the other element of running and working water? Thank you.
Yeah, no, that's an outstanding question because we got a lot of rain this last weekend. And over the weekend, DWSD received 112 water and basement complaints after that storm. And we've resolved 50% of them. We have crews out that are trying to resolve the rest today. In most instances, when we get out there, we do one thing. We put a camera in the sewer to see if it's blocked with tree roots or it's failed, it's collapsed. 60% of the time, it has not. 60% of the time, it is the customer's private sewer line that runs from their house normally to the alleys. In some areas of Detroit, it runs out to the street and connects to the sewer line. Those average lines are about 90 years old and they've failed. If that line fails, it is a private homeowner issue. It's not a DWSD issue. So the first thing that we want to look at is it just one person that is getting a sewer backup, or is the whole block getting a sewer backup? If it's the whole block, then most likely it's going to be DWSD's line has collapsed and we have to come out and repair that and make those homeowners whole. But if it's your private line, that's going to be your responsibility to have that fixed. And unfortunately, our housing stock and our assets are very old and they've outlived their useful life and they need to be replaced.
Thank you, Mr. Brown. We'll go to our next hand raised. That is Kay Fields. We're going to unmute you, Kay Fields.
Ms. Kay Fields, you have 2 minutes to ask your question.
Thank you. This is Crystal Fields from Jefferson East. Can you hear me?
Yes, we can.
Okay, very good. Thank you so much, Councilwoman, for the invitation and for your service. And Mr. Brown, I had a question for you specifically. Jefferson East will be conducting a short survey of some of our constituents in our service area. And so one of the questions on our little survey is going to be, are they without service? Have they applied for your program? And so once we get that information together, how can we share it with you? What's the best way if we find that we have 10 or 12 residents either in Jeff Chalmers or the Villages or Marina District or wherever, East Village, how can we share that information
Oh
with
yeah,
you?
I mean, yeah. Thank you very much. I mean, that is a great question also. And I mean, I'd be more than happy to come out and speak to that group. And if you were to just, call my administrative assistant, Renee Baker, at 224-4701, 224-4701, we could get that set up. Let me, I talked a lot about the $25 Restart program, but it's a very limited program. It's only going to deal with about, 1,000 people while we're in this emergency. We have another program, and we know people are going to need it after, this economic tsunami hits us. We're going to need some financial assistance. And this program is one of the most robust, compassionate, comprehensive assistance programs in America in any utility, whether you talk about gas, lights, or water. It's called the Water Residential Assistance Program. It's called WRAP, and I'll be glad to get you flyers to get out to your community. But it's better than the $25 plan in a lot of respects. There's only one qualification, and that's to be 200% below the level of poverty. And we know more than 50% of Detroiters are 200% below poverty. We know that for a fact. And so they automatically qualify. And so if they do, we will come out and do a survey of their home, look at their plumbing system, and we won't give them a list of plumbers and tell them they have leaks in their homes. If you qualify for the WRAP program, and we have 16,000 customers in that program right now, we will fix your plumbing issues up to $1,000 to get you to an average bill. The average bill in Detroit right now is $75. If we fix your plumbing issues, if we replace your high flow toilets with low flow toilets so that you're using less water monthly, you'll have an average bill. We will give you $25 a month on that bill. If you make the $50 payment a month, we will pay off all of your arrears up to $700. And if you are over the $700, you're outside the average, we'll put you in the plan for a second year to pay it completely off. So we'll come out, do an assessment of your plumbing issues. We will fix your plumbing issues up to $1,000. We will give you $25 a month on your bill, and we will pay off all of your arrears in the Water Residential Assistance Program. 50% of my customer base is below poverty, so they qualify. 50% of my customers are renters. They also qualify. You don't have to be a homeowner in this particular program. So it's the WRAP program that we would really like to share the literature for you to get the word out about. And again, we've had 16,000 people go through that program. Thank you for the opportunity to be able to share that.
Thank you, Mr. Brown. And I am restoring our council president who stepped away briefly. While she's coming back in, Director Fair from the Health Department, we received a call from a resident who actually had a death in their home from coronavirus. And what their concern is, now that that has happened in their home, what precautions should they take? Is there a number that they can call to get some assistance since their level of fear about coronavirus being in the home is heightened because a person who was residing in the home has passed? Can you give them any type of advice?
Sure. Thank you for your question and my condolences to the family. So here's what you can do if you believe you have been exposed to someone who has had COVID-19, and this goes out to everyone. If you've had close contact with someone who's had COVID-19, but you yourself are not experiencing any symptoms, monitor your health symptoms for 14 days after your last contact with the ill person. Do not go to school. Don't go to work. Avoid all public places for 14 days. If you are in close contact with someone who has COVID-19 and you yourself are sick, please make sure you call your primary care provider. They will provide you with those instructions. You can also call the Detroit Health Department 313-876-4000. But if you yourself are feeling sick, if you have fever, cough, shortness of breath, make sure that you isolate yourself. Again, please stay home. Now, this is really important. If you are at higher risk for severe illness, so if you're over 60, you have underlying healthcare conditions, again, please make sure you call your healthcare provider. So if you have heart disease, lung disease, you have a weakened immune system, please do not wait. Call your healthcare provider. And that's really, really important. Also, this is a difficult time. And so I'd encourage you to visit, I believe it's I'm gonna try to get this name correct, the Detroit Wayne Mental Health Authority. I believe they changed their name, but just reach out to them for some guidance to make sure that you're getting the resources that you need during this difficult time.
Great, thank you so much, Director Fair. We appreciate that. I want to turn it back over to our Council President, Brenda Jones.
Thank you, Mr. Grady. And I know we have others who have raised their hand. Who will be our next participant?
Yes, ma'am. The next hand raised that I see is Essence. Essence, I will unmute your audio.
Hi, so I just had a quick question in regards to, I know you guys are the city of Detroit has that site for drive-up testing, and it requires a doctor's prescription. But as we know, with this particular demographic, a lot of them are not connected to primary care physicians, nor do they even sometimes have insurance. How is the city going about handling that?
I'm glad you asked that question because that was one that I had a big concern with. I talked to the mayor about that. So that is a great question. Ms. Fair, you want to answer that question, please?
Okay, so I'm really glad that you asked that question. So just today, the mayor launched this new provider network. So he has asked providers who are accepting new patients to give us a call, and we have loaded them on our website. So there's primary care providers who are now accepting new patients, whether you have insurance or if you don't. So you can go online right now. It's already live to detroitmi.gov/coronavirus. And you can look and see all of the, I believe 20 providers have already signed up. So you can see where you live in relation to where those providers are, and we will connect you. The mayor's, one of his #1 priorities is to make sure that every Detroit resident has access to a doctor, whether they have insurance or not. That is a #1 priority. So again, if you or your loved one needs a doctor, go to detroitmi.gov/coronavirus or call us 313-876-4000 right now, 24/7, so we can get you connected.
And so, Ms. Fair, there will not be a charge for them to get that prescription from that doctor. Can you talk about that as well? Because as you know, our Detroiters do not have the money to pay, do not have the health insurance. And I know you said if you do not have health insurance, but can you erase the fear of what would be the charge for me to see the doctor to get that prescription?
So I can't speak to the individual providers. What I can speak to is that if you get a script from your primary care provider, you go right to the drive-through testing, there is no charge for the drive-through testing. So just get the script, drive up and make your appointment, and there's no charge for the appointment. There's no charge for the test.
Okay, so my question was in regards to the Detroiter who do not have a doctor that need to get that script to get that appointment to come to the drive-in center.
Yeah, so again, so the very first step is to visit our website, find out the nearest provider, give them a call, and then they will speak to you in regards to whether there's a charge or not. Most of the primary care providers that are listed on our website, they take patients, whether they have insurance, whether they don't, and some of them have a sliding fee scale. And so again, visit the website for further information.
Okay, thank you for that question. Our next participant?
Yes, our next participant, Madam President, is Beulah Walker. Beulah, I will be unmuting your audio, and then after Beulah Walker, Essence, I see that you have your hand up again. I will be calling on you after Beulah Walker.
Thank you.
Beulah, you are unmuted.
Ms.
Hello?
Walker,
Hi, can anybody hear me?
we can hear you just fine. Thank you for your call.
Thank you. I have a concern with Mr. Gary Brown. Can you hear me, Mr. Brown? Hello?
I can hear you if they unmute me.
Okay.
I can hear
Mr. Brown, we have a 86-year-old resident of the city of Detroit that had, like you say, flooding over the weekend, and we hired a master plumber to go in and drain her basement out, and the next day she had more flooding. So the plumber went in and with the snake, and he went 100 feet, and he said that's as far as he can go. But according to Miss Alice, who's 86-year-old, she said this is the third time that this has happened. So we called the emergency number to DWSD to come out and look at it, and they haven't arrived yet. But according to Miss Alice, she said this has happened before. So what do you want us to do?
I want you to give me her address. As I indicated.
I don't want her to do that on the phone.
Yeah, she has my, I know, I'm almost sure you have my staff or my.
Yes, I do. I do.
I know you do. So here's what's happening. One of two things is going on. It sounds like her private lateral service sewer line has collapsed. And so you can snake it out 100 feet, but if the line is collapsed, it's just going to fill back up because it's not making its way to the sewer. And so we can put a camera in on our end and see that, but we need to probably try to find her some help, find someone that can finance replacing the lateral sewer line so we can make the problem go away. I just need the address and the contact information, and we'll take a look at it.
Thank you, Ms.
Council
Beulah.
President, I have messaged Ms. Beulah on Facebook. So if she want to respond to Facebook, then I can get the address and I will give it over to Mr. Brown and his team.
Okay, so Ms. Beulah, you can either contact Mr. Brown or either, and I don't necessarily want that information on Facebook, so can you just contact Mr. Brown's office and give him that information, his staff, someone will receive that information, or Mr. Brown himself.
Madam President, can I also ask Ms. Walker, I mean, we're looking for a list of customers that have their water off right now, and I know that she has her ear to the ground in the community, and if anybody in this city can find people that don't have water, it's her. So I've got like 50 plumbers standing by, ready to go. So if she also could provide any other addresses of folks that may not have water, we would like to get that water on also, along with helping the senior citizen with her sewer line.
Thank you, Ms. Beulah Walker. Please, if you have or know anyone, and that is to any of our listeners, if you know anyone who has no water service, please give us that information to ensure that our Detroiters get water service. Who is our next participant with their hand raised?
Madam President, I'm going to unmute Essence, who has her hand raised, and then right after Essence will be Calvin.
Thank you. Essence? Essence?
Essence, you're unmuted. Go ahead.
Thank you. So just another question along those same lines for the testing and trying to like think outside of the box in terms of the prescriptions. Is there a way, and I'm thinking primarily in terms of people who know they have been exposed potentially to someone with COVID-19 through either their family member being diagnosed and tested. Is there a way that when that immediate family member or friend is tested, that the doctors, that the city of Detroit can potentially partner with some of the local hospitals so that the doctor who tested that person can just like write out a prescription for that person's family member so they can be tested as well? And I'm thinking in terms of like the Narcan prescriptions that are written on behalf of that person who has the history of addiction, but the family member can go and get that prescription filled.
Ms. Fair? Can we unmute Ms. Fair, please?
Yes. Okay, here I am. Essence, I love how you are thinking, and thank you again for your question. So testing is only available for those who are experiencing symptoms. So if I wanted to go and get a test right now, I really wouldn't be able to because I haven't had any connection with a COVID-19 patient, or I don't have any symptoms. But the best way, if you want to get tested, you have to start with your primary care provider. They will examine you, they'll ask you what your symptoms are, and then they will determine whether you should be tested. And so again, I really like how you're thinking. At the health department, we are partnering really closely with all the hospitals in Southeast Michigan, the local health departments, because we want people to be tested. We definitely want to do that as long as they have symptoms. And there are different priorities. So at the state level, they determine the qualifications for testing, and that has been communicated with hospitals, with providers, as well as with the Detroit Health Department. So again, thank you for your question. I like how you're thinking outside the box. Thank you.
Thank you, Essen. I just want to, before we go to the next person, I just want to say tomorrow I will be on 9:10 a.m. I will be on 9:10 a.m. From 7 a.m. to 9 a.m. And I will have with me Dr. Ringo, and Dr. Ringo has been asked by the CDC, the Center of the Control Disease Center, to look at what is going on in Michigan with the coronavirus. She will be my first guest tomorrow, and perhaps she can also add in on to what Ms. Fair has said. Ms. Fair is giving great information, but we can never get too much information on this coronavirus. So I just wanted to also let everyone know that's interested in what's going on with the coronavirus. Tomorrow, 7 a.m. to 9 a.m. I will be on 9:10 a.m. Mr. Brown will also be a guest on 9:10 a.m. along with us, and we will be revisiting the same topic, the coronavirus. Our next participant, I believe, is Calvin, who has his hand raised.
Yes, ma'am, Madam President. Calvin will be our next participant. Calvin, I will be unmuting you, and you will be followed by DW.
Calvin,
you're unmuted.
Hello?
Calvin, go ahead. Calvin?
Looks like Calvin dropped. So I'm going to DW. DW, your audio is unmuted.
DW? DW?
Yes, thank you for taking my call. I just wanted to provide a comment about the DWSD resolution that was unanimously passed by council today. I just want to thank you, Madam Councilwoman, for making that happen. This is a very great opportunity for the City of Detroit residents to be waived of late fees, penalties, and also connection fees when this is all over. Thank you for taking preventative steps and leadership. I also want to recognize Governor Whitmer for passing the statewide resolution on executive order on water shutoffs to be restored all throughout the state. This is very great for the City of Detroit residents that have been dealing with dangerous water shutoffs since 2014. My question in regards to these orders, I wanted to hear Gary Brown's response and what the DWSD has taken to make sure that these orders are being enforced and followed. In Whitmer's resolution, Whitmer's executive order, it says here that the public water supply must work with residents other than non-payment. He mentioned those that were in properties and that we're dealing with properties and such. Now, some of those people that are in properties that are renters that may be owned by other property owners that are not listed on the water accounts. Some tenants that are living in properties that are having trouble restoring their water because the property is not in their name. I also have an address as well of 2 people that could be in this situation. And I also wanted to know how is it that we can make sure that these orders are enforced so that everyone will have their water turned on? And the last question I have is, what is the policy, since Gary Brown says that there is not enough plumbers, is there a policy that could be created for City of Detroit residents to turn on their own water using water keys without prosecution or felony criminal prosecution? Thank you.
Yeah, thank you for the opportunity. And I'll also give the number out one more time at 386-9727. 386-9727. If you just have those 2 people that you know of, call that number. A work order will be created for their house the next day. And I maybe you misunderstood me or I wasn't clear. I do not have a shortage of plumbers. We just put on 4 emergency plumbing contractors that have the capacity to take care of the calls that we are getting right now and in the future. I'm asking people to be patient because some of the plumbing repairs that we're making inside the home, some of these homes have been vacant for 3 to 5 years, and the plumbing repairs are extensive. We have to break out the cement floor, we have to go through walls, we have to replace lead service lines, and so you can't do those kind of repairs in 20 minutes. They'll take a couple of days in some cases. But make no mistake, we have the capacity, we will get through them all. And so again, I'm gonna follow the letter of Governor Whitmer's executive order to the, to the letter. I'm going to be reporting to her on a daily basis the number of homes that are being repaired as I'm required to do. We're going to make every attempt to contact every Detroiter that is out of water. And DW, I know that you have your ear to the ground, and if you could provide a list of customers that are off the grid that I don't have in my databases, it would be greatly appreciated. And thank you for providing those names in the past. You've given me more than 40 names of people that we've been able to help. And we thank you and thank you in advance for what you could provide in the future.
I want to also thank you as well, DW. Let's get the information to Mr. Brown. If you know someone who does not have water service right now, I want to also thank Governor Whitmer, who has worked tireless to get things done during this period of time, and also to ensure that all residents, all Michiganders have water service. And we have to do our part to get that information to DWSD in case DWSD does not have that information. And I want to thank you for tuning in this morning, knowing that we were able to pass that resolution. I look forward to, again, our DWSD board passing that resolution for relief for Detroit, everybody in the city of Detroit who has water, as well as relief to the people who are customers of the Great Lakes Water Authority. I have also tasked Mr. Brown and his group with another chore of finding out what we need to do and coming up with a plan to ensure that the customers, the citizens, will still have working and running water once we go through what we are going through now. And as I've said, this too shall pass. It's a season that we're going through right now, just as summer, winter, spring, and fall. This season that we're going through right now with COVID-19 too will pass, and we will need to ensure that people have running, working water when this season does pass. Thank you, Governor Whitmer. Thank you, Mr. Brown. Thank you to all of the listeners, as well as those who have their ears on the ground, their feet on the ground, trying to assist all of those out there. And some of those that assist are not even on this call, but I just want to give thanks to everyone who's out there assisting those that do not have water service, those that are out there assisting in this COVID-19 pandemic that we are going through. Thank you. I cannot say thank you enough. I'm self-quarantining myself because I know with all the people that I've been around, I have been exposed. And so I don't want anyone to be exposed of anything. So I'm self-quarantining myself. Who is our next participant?
Madam President, I have 3 people who have raised their hands. Calvin, who has rejoined us, and Calvin, I'm gonna unmute you momentarily. After Calvin will be DW. After DW will be Empire Market.
Okay, we've heard from DW. So I know Calvin, and I don't have a problem hearing from them again, but I would like to at least hear from everyone first before we go to someone that we've heard from. So Calvin, you have the floor.
Calvin, your audio is unmuted.
Calvin, are you there? Calvin is still muted. Calvin, are you there? Calvin, are you there?
Calvin, you are unmuted.
I'm
Calvin?
here. Hello, hello.
There
Thank
you go.
you. You
Hello?
have the floor.
Okay, yes, so the computer is having technical difficulties. Okay, Mr. Brown, so in the work that I do, I'm dealing with a very vulnerable population. And this population was very vulnerable prior to this pandemic. And so now that the whole world is vulnerable to what is actually taking place, these individuals are even more so vulnerable. So my job is to get this information to them so that they can get the sort of things that they need. And so when I was speaking to you about the working water, what it is that you provided me with information with regards to RAP, what we understand is that there's over 100 and something people that have experienced basement flooding as a direct result of the heavy rainflow. And some of these individuals are dealing with slumlords or they may be homeowners who cannot necessarily afford. So what do we do about these elderly people or individuals who are dealing with slumlords that we can equilaterally, provide them with some much needed assistance, because we're dealing with a very serious social determinant of health when we're looking at it from a public health lens.
Yeah, that's a very good question. What does a tenant do when they're working with a slumlord? And that's really a question to be answered by our buildings and safety department. You're absolutely right. What we're seeing right now, who's calling us right now, are a lot of tenants, and these private plumbing issues that we're fixing because this is an emergency. These are the homeowner's responsibility. And after the emergency is over with, we have to find a way to hold them accountable, even if we have to sue them. Now, if they were a commercial homeowner that had an apartment building or a nursing home, I would sue them. It's difficult, the courts, for me to take private homeowners that are renting one piece of property to court. But there are mechanisms that the city has in place through buildings and safety to deal with slumlords. And let me just finally say that, after this is over with, and right now it's all about getting the water on because we're in crisis. It's no questions asked. We don't care whether they're a tenant or a homeowner or they're there legally or not. We're not going to turn the water off, and we're going to turn it on if we can, if it's at all possible. But this is what people need to understand after this is over with. They're going to need to be on the property legally with a lease. And if they're not, then we want to help them become legal. We want to show them how to get a property transfer affidavit filed with the assessor's office so that when this is over, they are legally on the premises. They're going to need an account with DWSD. You have to have an account. They're going to have a meter. It's unacceptable for people to go out and get their own key, as one of the callers described, and turn the water on themselves. We want to help the most vulnerable population in the city of Detroit, but they have to be willing participants in letting us help them. And so calling Wayne Metro and allowing us to help you be on the property legally with if you don't own it, with a lease. And if there's a landlord-tenant issue, we can help you get through that process. But you have to have a lease, you have to have an account, and you have to have a meter that's operating in order for us to provide the wraparound services with WRAP. Thank you.
And I just want to say, Mr. Brown, again, Wayne Metro is standing by to help assist those who are in need of assistance, who meet those qualifications. Is that correct? And how much money do Wayne Metro have to be able to assist the Detroit residents? Can you unmute Mr. Brown, please?
If Jasmine unmutes me, I promise not to say
unmuted. You're unmuted.
I promise not to say anything that's going to be inappropriate or show any pictures. If she just promises to leave me unmuted,
we'll leave you unmuted, Mr. Brown. Thank you.
I'll call. What was your question again, Madam Chair? I was muted when I had my answer.
My question was, is Wayne Metro standing by, waiting to assist Detroiters who need assistance, and how much money do they have?
That's an outstanding question. Okay, because we just first of all, the Oakland and Macomb County did not spend all of their dollars in the WRAP program, and so they transferred 1.1 million of the dollars that went unspent in Oakland and Macomb County to the city of Detroit's WRAP program. So we're sitting on currently $2.5 million, and July 1st, we'll add another $5 million to the program. And then we're expecting stimulus dollars to come into play so that we can use those for assistance. So we have the dollars. What we need is for people to come in and apply. That's the biggest issue right now. Come in and apply. If you're 200% below the level of poverty, and that was just raised from 150, and 200% of poverty for a family of 4 is $52,000. So if you make $52,000 and you have a family of 4, you qualify for assistance programs.
What is it for a family of 1, Mr. Brown?
A single person, I'm not quite sure what that is. I think it's close to $20,000, but we don't have a lot of families of one in the city of Detroit that are applying for it. They're normally larger families.
Okay, thank you. I see we still have several hands that are raised. If we can go to the next caller, please,
Yes.
our next participant.
Yes, we do, Madam President. Our next speaker will be Empire Market Admin. Empire Market Admin, you are unmuted.
You have the floor, Empire Market Admins. Go ahead.
Hello.
Hello to you. Good afternoon.
Good afternoon. How are you? Hello.
Empire Admin, please go with your question or comment.
Yes, okay. So what do you think about Zoom and its privacy regarding rooms, as they're not very private and they're not very safe because a lot of people can join without the person's permission?
Who is that question for?
Everyone, like anyone who has an opinion.
Can you repeat your question, Empire Market?
Okay. What do you think about the safety of Zoom and joining rooms, because there has been a lot of raids recently where people are joining for no reason?
Yes, ma'am. People have been joining this meeting today for no reason and have been doing pornographic things and the other. However, each one of those IP addresses is being recorded, and we will be sending that report to the Detroit Police Department's Cyber Crimes Unit, who will be investigating. So for those people who are coming onto the video conference with a less than honorable intent, we will be following up with that. That is what we think about that. Thank you so much, ma'am.
Thank you.
Our next speaker will be DW. DW?
DW, you have the floor. Can we unmute DW?
I unmuted DW. Someone keeps muting DW.
No, I don't know who could mute me, but yes, I just wanted to follow up and just thank everyone for taking the preventative steps and measures to prevent COVID-19. I understand that we all have to work together and we have to share information and be open with communication to the best of our ability concerning this pandemic. Madam Councilwoman, I would like to propose to you to work with you on the COVID-19 service plan that you proposed today earlier in council. I feel that this is a very great step in preventative measures for the after effect of COVID-19. We just don't want to end up in a situation to where a mess has been created and that it goes unsolved and it just piles up. My recommendation would be for you to, if you can, please schedule meetings by phone or by Zoom teleconference with water rights groups and activists. The water department, the board of water commissioners and staff could be on the call as well, and let's all work together to formulate this service plan. When I'm thinking it could be subsidized water service because of the economic downturn that has occurred during the pandemic of COVID-19. You have people that were at work, that are now out of work, claiming unemployment benefits. We need to keep water rates low if possible, or suspend water rates until this pandemic ceases and until we're able to shore up our situation to fix our water system. This is very important with what you're doing, Madam Councilwoman, but we want to make sure that we add suggestions and certain addendums to make sure that this service plan works in behalf of all Detroiters who have been affected by this downturn. And that's all I want to say. Thank you so much for your leadership, and thanks to Mr. Brown for displaying leadership and trying to get a handle on this. And thank you all.
No,
Thank you so much.
Can I
Go ahead, Mr. Brown, and I'll comment after you. Go ahead.
Yeah, I just want to say that in the stimulus plan that was originally proposed, there was $1.5 billion in play for water assistance that you could build affordability plans with. At the 9th hour, that money was taken out of the stimulus plan. And so in order now to fund an affordability plan, we're going to need federal dollars. And I want to thank the council president for taking the leadership in the leadership role in trying to push the federal government toward funding these programs. It'll be a different ball game if the funding is there. So thank you very much.
Thank you so much. And thank you for your comment also, DW. I look forward, and I know we don't have that money right now, but I look forward to us getting that money. I asked Mr. Brown, I gave him the task of him and his team coming up with something. And then once they come up with something, perhaps we can assemble that group, as you indicated, and go through the plan that Mr. Brown has. I see Mr. Brown smiling, but I would love to have Mr. Brown come to us with a plan that he feels that can be worked, and we can look at that plan and give suggestions and recommendations, as well as try to get additional dollars from the federal government, because we will need additional dollars here in the city of Detroit from the federal government, as you know, and we're about to go back into our budget season. Our budgets are going to be hurt tremendously. Just looking at the money that we were receiving from the casinos, that money is not coming in the way it would have been coming in, because you have 3 casinos that are closed. Tax dollars that we would have been receiving from businesses, we won't be receiving those dollars because you have many businesses who have closed. And I can just go on and on and on, but we will find a way, because we are strong Detroiters, and we always find a way to make a way out of no way. And so I know we will work together and find a way to help each other, as we are doing just right now. So thank you so much, DW. Thank you so much, Gary Brown. We have 15 more minutes, and I see we have 4 participants who have raised their hands. Just let me also say again, tomorrow, I will be on from 7 a.m. to 9 a.m. with health expert Dr. Wendy Ringo, who has been asked by the Center for Disease Control and Prevention to help monitor the spread of the coronavirus in Michigan. You will also have Mr. Brown there with us on the panel, who hopefully we will be able to get answers and recommendations, as we are doing today, to all of our callers. Communication is so vital. And if we don't have that communication, what happens is we get misinformation, and we start passing the misinformation around. And so I've had so many conversations with the mayor, so many conversations with Mr. Brown. Ms. Fair is doing an awesome job. Hakim Berry is doing an awesome job. And again, all of the teams who work for the city of Detroit, my team, all of my colleagues are doing an awesome job as we go through what we are going through right now that we have never seen before. Let's unmute our next caller.
Madam President, I have 2 final callers in the line, and then I will cut off comments for any closing remarks from our panelists or from you. I will take this next caller is actually a phone number. The last 3 digits of the phone number is 058. 058, you are unmuted.
Good evening, Madam Chair. How are you? My question is about the homeless population that's on the streets. In the city of Detroit, we have several homeless shelter programs where individuals can come in by 6, but they have to leave by 8 o'clock that morning. How can the virus be maintained upon with that population? Is there a plan of action? With Detroit being declared a hot spot, how can we limit the surge with that population? Because there are still individuals that's on the street. There are still individuals that's holding up signs because everyone is trying to survive. Is there a plan of action to deal with the homeless populations in the city of Detroit, but not just the city of Detroit, the most empowered communities in Wayne County? Thank you, Madam Chair.
Thank you so much for that question. I don't know if, and I know we received some information, I don't know if Ms. Fair wants to tackle that, but let me also say that I work hand in hand with the rescue mission. If anyone has any situations that needs to be addressed, I'm working hand in hand with the rescue mission to ensure that we can get assistance to those who are homeless. And perhaps Ms. Fair can also come in and add some additional information, because I've asked yesterday, as we were on a call yesterday, I asked about the homeless population on yesterday, because we definitely have to ensure that we are also dealing with our homeless population, and I am also working on that as well. Ms. Fair, if we can unmute Ms. Fair, please. If we can please unmute Ms. Fair.
Director Fair.
Okay. Yes, thank you. Okay, so I don't want to speak on behalf of the HRD department, but I will tell you that they are doing a phenomenal job to make sure that our homeless population is protected. So I can share with you what I know based upon the work that they are leading. At this point, there are about 11,000 people who are homeless in the city of Detroit. And you know, this population, they also need to be protected. And we want to make sure that they have resources. And so the city of Detroit, the partnership of HRD and the city of Detroit, they have a quarantine location for any homeless individual who has a elevated fever. So if their fever is at a certain temperature and they're in the different shelters, they are being transported to a quarantine location to make sure they have the care that they need. Also, we have a partnership with all the local hospitals so that if there are homeless individuals who are being treated, if they have COVID-19 or if they have symptoms, they are being discharged. We have transportation that goes from the quarantine location directly to the hospital, picks up the homeless individual and provides care for them right at the quarantine location. So the city is making sure this is a priority. And I would encourage you to visit the Detroit Health Department website or detroitmi.gov/coronavirus. And there are specific resources there for homeless shelters or for those who are experiencing homelessness. Thank you for that.
I'm sorry, I didn't mean to cut you off, Ms. Fair. Did you come?
No, I just said thank you for the question.
Okay, thank you. And let me also add that the city of Detroit is partnering with Wayne State to launch a COVID-19 testing for homeless individuals at shelters. And so today, the city of Detroit, and I believe it was yesterday, the city of Detroit Housing Revitalization and the Health Department launched COVID-19 testing for the homeless people currently in the shelter systems, and they will be conducted at a designated Salvation Army shelter with the support of Wayne State University, the Community Foundation for Southeast Michigan, and its foundation partners, the DMC Foundation. And so I want to thank Wayne State for their assistance. Again, so many people are coming through assisting. I want to also thank the Salvation Army for their assistance as well. Our next participant.
Madam President, we have one final comment from Kay Fields. And also I'd like to mention that we are working to build out our schedule of activities for next week's digital outreach meetings, and we will make sure that we involve Mr. Donald Rencher from HRD and possibly Dr. Chad Audi from Detroit Rescue Mission to address housing and the homeless in our series next week. This final comment comes from Kay Fields. Kay Fields, you are unmuted.
Okay, thank you so much. I hope you can hear me.
Yes, we
I can hear you.
Okay, very quickly, this is directed towards Director Fair as well. It would be helpful going forward if you and your colleagues could push out a phone number or a resource for grief counseling. One of the things that I really love about Detroit is the fact that it's really kind of like a big old country town. And so we act like we're so cosmopolitan and progressive, but it's actually, we know each other. So every time we see someone's name on the news, like this Studemeyer kid who just passed, come to find out he was doing some consulting with my employer. And so my colleagues are shell-shocked behind it. They just had a meeting with him before that. So it would be helpful if people had a phone number where they could call and talk to somebody who's trauma informed in terms of, some grief counseling. You may not be able to go to a group meeting because of the virus, but I just want to say that, you guys are doing a really great job. The phone numbers are very prominent on the city's website for the water recovery service and the testing and the COVID-19 information. That's great. But in terms of the grief counseling, I think we're going to need that. And Detroiters seem to wear this veneer like we're untouchable and invincible. We're going to need grief counseling, whether it's through Ascension, St. John, Open Arms. Those are great folks. I just don't have phone numbers that I can share with my constituents. So I don't know what people are doing about the grief counseling. Thank you.
Ms. Fair?
Yes, Ms. Fields, thank you for your question. And you're right, we need to make sure that we are communicating mental health resources to the city of Detroit. And I have that phone number for you right now. So all the resources are available at the Detroit Wayne Integrated Health Network. And their helpline is available 24/7. That number is 1-800-241-4949. Again, a 24/7 helpline. If you need any help, that number is 1-800-241-4949. I'm also going to encourage my communication staff to upload this resource available on our website this evening. So Ms. Fields, thank you so much for that comment.
Thank you. And I could have used a grief counselor just the other night when I heard about our own elected official who has worked tirelessly, Isaac Robinson. I could have truly used a grief counselor then, because I was so hard stricken then. I was just hurt. And I set up, I could not even go back to sleep. When I heard about our own Isaac Robinson, and I send out much prayers and many prayers to his family and his friends and his loved ones. And we've lost so many people, and officers, first responders, and friends and family members. And so we must continue to help each other. Again, thank you, Ms. Fair, for that information. I'm going to take just a couple of minutes, and we only have 3, and ask each one of our panelists if they want to take 1 minute just to wrap up anything they have to say. And I'm going to, since we stopped with you, Ms. Fair, I'm going to start with you. And if the gentlemen don't mind, today I am going to go to our women first, and then I'm going to come back around to you. And I want to thank thank Ms. Casey, who has been so patiently waiting. Ms. Fair?
Thank you, Madam President, and thank you for taking charge. Thank you for helping to lead the city and to develop ways that we can communicate with the city of Detroit. So I applaud you and I honor you, and my hats are off to you. So here's what I want to make sure that I talk about over the next 1 minute. So it's so important to make sure that we are staying home. That is one of the great ways to help slow the spread of this virus. So please take extra precaution to distance yourself from others to further reduce your risk of being exposed to the virus. Please make sure that you can call our health department, 313-876-4000 if you have any questions, you have concerns. Send us an email at dhdoutbreak@detroitmi.gov. I said this today during the recent press conference, that this is our responsibility. This is kind of our new reality. So it's our responsibility to get educated and to make sure that we're sharing this information with our loved ones. So again, please visit our website for more information. And finally, I want to thank everyone who has worked so hard to make sure the city continues to thrive, especially our grocery workers, our gas attendants, the food distributors. We appreciate you. And of course, all of the 200+ individuals in the Detroit Health Department right now that are working literally around the clock to make sure the city is protected. I'll say one final thing, because I can probably talk for another half hour, but I want to make sure I respect all that are here, is just to make sure, again, you stay home, because this is going to take a village. Nothing stops Detroit, and we want to make sure that we all have our part to slow the spread of this virus. So thank you, and thank you for the opportunity.
Thank you, and thank you for the work that you are doing as well. Ms. Erin Casey, if we can please unmute.
Thank you,
Erin,
The floor is yours.
Thank you. Thank you, Madam President. I appreciate this opportunity to talk with folks today about some of the work that we're doing in the Recreation Division to ensure that that families and seniors continue to stay fed during this crisis. I also just wanted to take a moment just to touch very briefly, although it wasn't a topic of conversation today, about park usage while I'm here. We want to ensure that as folks, maybe out taking a walk to get some exercise, that folks are staying off of our park amenities. They're not using the park shelters or the play structures or the fitness equipment. We know that those are surfaces that the virus can live on for multiple days. So we're asking that groups continue to not congregate in our parks. There are park usage rules that apply to this time of the crisis up on the Detroit Parks and Recreation webpage. So if you have any questions about what you can or cannot do in the parks now, we're encouraging you to refer to those. And just to echo Denise's comments, we are encouraging that in general, folks stay home. If you have to get out and walk your dog in one of our parks, please practice social distancing. Do not go out into the parks in groups. And again, please refrain from using any of the park amenities at this time. We are working hard to assess the need for further expansion for our meal distribution. And so we will continue to update the community as soon as we have additional information. And just one final note, we are working to have a food distribution dashboard released later this week that will be a comprehensive resource, not only for the food distribution sites for the city of Detroit, but for all partners across the city. That will be updated in real time. So we'll make sure to notify folks when that's up and ready. And so I'm just grateful for my team that's hard at work, providing meals to folks all across the city. And I'm grateful for the work of all of the folks who are on this panel today. Thanks.
Thank you. Mr. Brown, looks like they muted you again. If you can unmute Mr. Brown, Director Brown.
Mr. Brown, unmuted.
Thank you very much, and thank you for this opportunity to get the word out. I kind of want to continue on that theme of a village, and I want to ask all of those that may be adversaries or advocates of DWSD to let's all just come together while we're in crisis and do what needs to be done to find and locate the most vulnerable of our citizens that do not have water at this time. Because DWSD only has one goal while we're in crisis, and that's to get the water on for anyone that doesn't have it. So whether we can, after the crisis is over with, we can go back and advocate for our positions on how we think the water department can be run. But right now, let's identify, let's find them, have them call Wayne Metro at 386-9727. And remember, the only people that will qualify for the $25 program are the folks that are currently living in a house without water. You will not qualify if you have water and you're behind in your bill. You want to get into the RAP program. We have something else for you. You won't qualify if on the 1st of April, you're moving into a new house then you want to get into the plan. This is for people that do not have water and are currently living in the home. So again, Madam President, thank you for giving DWSD and me the opportunity to get the message out. I look forward to your radio program tomorrow morning, which will be another opportunity to get the message out. And if we're all working together with that one common goal, we can't help but be successful. Thank you very much again.
Thank you. And do we still have Mr. Berry, Hakim Berry, Chief Operating Officer, standing by? I know you've been extremely busy today.
Yes, we do, Madam President, and his audio is unmuted.
You are unmuted, Mr. Berry. Hakim Berry. Hakim Berry. Perhaps he got an emergency that he had to tend to. We do know that he is out at the site working, yes, and we have had many people who have drove up to the site to be tested. Ms. Fair, can you again, do you remember the numbers of how many people we had on yesterday, and do you know how many people we had today that have been out to the site to be tested? If we can unmute Ms. Health Director Fair.
Yes, so I'm not sure the number that we had yesterday, but as of this morning, we had over 700 appointments that were already set for the day. Our original projections was about 500 tests per day, but we've already exceeded the capacity. So we're doing great work. 700 tests a day is phenomenal. And this really was a collaborative effort.
Thank you so much. Again, I want to just take this opportunity to thank all of the panelists that have given up their time to participate today. I want to thank all of the listeners and all of the participants who have participated, all of the callers, all of everyone who has participated in my first community digital outreach meeting. I want to take an opportunity to thank my staff who have worked extremely hard in putting these meetings together. They are up half of the night, if not all night, working to get this together. So I want to thank you as well publicly to all of my staff. I want to say, if you did not have an opportunity to speak today and you wanted to speak, and it is something that is definitely city related that Mr. Brown cannot answer because you didn't have that opportunity, he will again be joining me tomorrow on my first radio show with 9:10 a.m. from 7 a.m. to 9 a.m. We will also have health expert Dr. Wendy Ringo, who has been asked by the Center for Disease Control and Prevention to help monitor the spread of the coronavirus in Michigan. She will be there speaking with us tomorrow, again, along with Gary Brown. I thank everyone for tuning in. I say to everyone, please, please, please stay safe and keep the ones that are around you safe as well. You may not have the coronavirus yourself, however, you might be a carrier. Remember that. You might have been exposed to the coronavirus. Your immune system might have been able to fight it off, but the next person that you come in contact with, their immune system may not be able to fight it off. So I want to say to you, please, please be careful. I want to say to you again, keep your hands out of your face. Do not, and that is the main reason people are wearing the mask, to prevent them, unless they are testing, to prevent them from touching. We are touching people, and we often touch our face, touch our nose, touch our mouth, rub our eyes. Please, please, catch yourself as you're doing it. Continue to wash your hands with hot water and soap. Continue to use your hand sanitizer. And remember, be safe. We are strong Detroiters. Continue to love and work together. Again, this is my first digital community outreach meeting. I look forward to seeing you tomorrow and talking to you tomorrow at 4 p.m. as we will have different guests. I'm sure, Ms. Fair, we will have to invite you again because there's just so many questions. Again, thank you to all of the panelists. Thank you to all of the participants who made this possible. And thank you to my staff and all of the participants who have tuned in, zoomed in, called in, and waited to talk to us. God bless, and we look forward to talking to you again tomorrow, 7 a.m. to 9 a.m., 9:10 a.m. This concludes our community outreach engagement for Tuesday.
Stephen, stay on the line because Mike is gonna bring in DPD or the investigators to figure out how we can work.
We are still recording.
We are not recording, I don't think so.
Okay,